do you use for talking with kids with ADHD to get the best information and stimulate conversation to get the best from the time with them?
As a pediatrician, a lot of my history is actually obtained from the parents, not so much from the child. But when I'm interacting with the child, like during the physical exam, I definitely make eye contact. I try to glean from history or prior notes or something. What are their interests? I'll ask them, what did you do for fun today or at school, or some leading question that can give me that information just to let them know I'm interested in them as a person. And I also want to find out their strengths. Maybe they're failing in school, but they're excellent at drawing or they're excellent at sports. I want to draw that out of them to make them feel like they're not a loser, because that's the worst feeling, right? I want to give them a win. And based on the win, we start building on the weaknesses. We build up the wins and then we show them they're really a smart kid, a bright kid. They have a lot to look forward to, and we're going to help them with the math or the reading that they're struggling with.
That's probably great advice for anybody working with these children and also for family members and grandparents to help support the children and also the parents.
It's been harmful to label these children as bad children in the past. They're people with a diagnosis. That's all. So if somebody had diabetes, you wouldn't say you're bad. It's the same with these children. Just because they have a label or diagnosis, you don't want to say you're bad. You want to say you're a child of God, you're beautiful, and you've got all these talents and you're fun to be around. And we're just going to help you with the weaknesses that you have. But we see them as a person and we have to reflect that to them, because I think they start self-talking. The self-talk starts becoming depressive and they put themselves down and they beat themselves up. And we need to reverse that before they head into true depression. I've seen that happen.
Does that mean keeping communication very simple? Is that
It is, and that you bring up a good point. Most of those kids can't remember stuff. If you tell them 5 things to go do, they may remember the last thing you said, not the first 4, because their brain is not wired to think sequentially like that. They're very impulsive and they've got a lot going on in their minds. They'll only remember one thing. And even if you said one thing, for example, go up in your room and get me your book bag, they'll go up to their room and then they'll forget, what did I come here to do? And they'll have to come back down. And they sometimes may look bewildered, like, I'm lost. It's like, where's your book bag? And then they'll go back up and it may happen again. Like, it might need to be repeated several times before they remember, okay, I'm here to get the book bag. We all experience that to some degree, especially if, like, when you're really preoccupied and thinking about a lot of things, you'll find yourself forgetting, like, what did I come in here for? And those kids have that going on all the time, bless their hearts. They do have so many thoughts floating in their minds all the time that it's hard to focus and hard to remember what they're up to.
I suppose giving them positive attention and feedback on good things so that they have
Very important.
experiences.
Whatever their strengths are, we want to nourish and encourage. Whenever they succeed at a task, we want to encourage and praise. Like doing homework, I see these kids, they do their homework, they get it done, and they remember, they know the words. Let's say they're doing sight words, but by the next morning, they've forgotten it all and they get a 0 on the test. And the parents can't reconcile, like, we studied, we did well, we knew it yesterday. Why did we forget? It's just the way their brain is metabolizing. It doesn't seem to anchor things into long-term memory for a while. They require a lot of repetition.
And then they can be recruited into that process of helping
This
the
or
child with their focus. How long will my child need to be on medication, or can they outgrow the symptoms? Will things improve in the future for them, especially at school?
yes to all the questions with a caveat. Nothing changes unless we change certain things. It starts really with our lifestyle and our diet to help improve the deficiencies or the toxicities that that child is experiencing. If a child has certain vitamin and mineral deficiencies, protein or omega-3 deficiencies, probiotic deficiencies, we want to give those to the child. We want to improve the quality of the foods they're eating. If they're high on sugar all the time and processed foods, that needs to go, and we need to give them healthy ingredients like real fruits, real vegetables, real meats, and healthy fats. They may not depend on the medications forever if we do the right things for their biology. I've seen kids, let's say I might diagnose somebody with celiac disease, and we know gluten is a no-no for those children. The minute I take them off gluten, their ADHD is gone. They don't need the medicine anymore. For other kids, it may take a little bit longer, especially if they have multiple things going on and toxicities we have to clear, but it can be done. And when you grow up, you kind of let go of the restlessness, somewhat of the impulsiveness, not always. You're left with the inattention and lack of concentration ability. But as an adult, you've learned skills, you know how to center yourself, you can put music on and that helps you focus. You find other coping skills to help you navigate, or maybe you pick jobs that don't require a lot of intense focus for long hours. Maybe you pick something that's outdoorsy. I'm thinking of an artist, it's more flowing and spontaneous. You can find ways of working through your life and finding what works for you, but you have to be an adult to make choices. Kids don't have a choice, they have to go to school. That's where we run into trouble.
What extent does my child have control over their own behavior?
They want to have control, but they can't. The executive function and the prefrontal cortex simply doesn't engage. And it takes maturing, it takes them becoming more of a teenager to have a little bit more to overpower their inability to control themselves. So a young child is just impulsive and very spontaneous. Teenagers have a little bit more self-control. And I'm talking without medicine. Like if we did no intervention at all, they're probably going to eat the wrong foods and not sleep at night and do a lot of harm to their bodies just because they're impulsive, right? So we as parents have to guide our kids because if left to their own devices, they will dig their own grave, unfortunately.
And I just wanted to go back a little bit to the question from the parents needing more support, some sort of therapy or cognitive behavior therapy, is that helpful for parents? Like, is it helpful for them to learn skills for themselves with coping and to be able to pass those on?
Yes, it is. And we need to change that. So just like there's more opening now with LGBTQT or whatever, like there's more opening about a tolerance, right? If a child was diagnosed with leukemia or diabetes, we wouldn't shun them. We would accept them. We would be compassionate toward them. These children deserve the same. They're just children, but they're wired in a way that makes them more restless and not paying attention. That's all. But they're still children. They're very loving, going. They have a lot to offer the world. We're just we're trying to make them fit into the school system, which is an artificial construct. It's not really what nature provided, right? So we created that environment and now we're forcing our kids to belong there. What we have to remember is, yeah, these children are still divinely created, just like we all are, and they have their place in the universe. We just have to nurture them and grow them as a loving way and accepting way as possible so that they can thrive and do the best they can as they become adults.
I love what you said earlier about your eyes not being able to focus, and so their brains can't focus. And if we start to see it from that perspective, like you said, if it was a child with leukemia, we'd have a whole lot of compassion.
Yeah.
And so perhaps a lot of this is about the rest of us learning, understanding.
It's society at large, not looking at these kids as troublemakers or bad kids. They're not bad kids. They're not doing any of the behavior on purpose. They truly just forget. I don't know if I said it during the recording or not, but you can send a child up to their room to get their book bag and they'll get to their room and forget what you told them to do there. They'll come back down all confused and like perplexed looking. And you're like, where's your book bag? Oh, that's what you wanted me to do. They'll run back upstairs to get their book back. It's just they forget. So if you give them multiple tasks, they're going to forget what you said. Like the first things you said, they're going to forget and only maybe remember the last thing you said. So they need very simple direction, lots of support. I think bashing on them and beating them down and telling them they're no good does so much harm, and it's not necessary, and it doesn't really build them up, right? Like it doesn't make them smarter in the way we want them to be smarter. Their IQ is fine. It's just they don't remember, and they have such a flight of ideas that they're constantly jumping from one idea to the next, and they just forget they left things undone.
Do things like giving them stickers and Joes or having sticker books or
Yes, they work to a certain degree. I think children really are not lazy. They do try to do the tasks that are given to them. They sometimes fall short. I think if they're motivated, so that's where the dopamine comes in. If they're motivated or given something to look forward to, they may produce more dopamine to get to that reward. We can definitely use incentives and reward stickers because the more we can praise them and the more wins we can give them, they're more likely to perform that again.
my child has problems getting along with other children in the playground? What can we do to help?
That's where they tend to not respect other people's personal bubbles and they don't listen to cues. So, like a normal child, if you told them stop or move away, they will answer the call. They will just follow the directions. But a child with ADHD, they almost feel like you're inviting them to come on in more. It's misperceived instructions and they tend to keep doing what they're not supposed to be doing, and that offends the other children, so they tend to shy away from them. So it's a matter of teaching the child to understand the cues, whether they're verbal or nonverbal, so that they can be better tolerated by the other children. Most kids are very impatient anyway, but it's like a battle of wills almost that happens on the playground.
Violent outbursts and violent behaviors.
Those are the irritable children who have ADHD. So in those children, a lot of counseling is necessary. I don't know that it clicks right away for them, but they do need the counseling. They do need the redirection in their behavior. And then we have to work them up to see what's causing the irritability. It could be a microbiome issue. It could be a lithium deficiency. It could be a copper excess. And then if they have other toxicities as well, that could trigger inflammation in the brain and irritability. Those are children. A normal child wouldn't act that way. That tells me right away biologically there's something that we need to pay attention to.